My name is Dr. Monica Christmas. I am a gynecologist at the UChicago Medicine. I am also the director and founder of the Center for Women's Integrated Health and the Menopause program here. Everybody always says they chose to become a physician because they like healing people, and that is true. I think maybe what I did not realize early on in making the decision that I like being a lifelong learner too. I love that medicine is ever changing, that nothing really stays the same. We are evolving. Things that I learned and did in residency, some are not even practices anymore. I really believe in patient autonomy. I take the patient-doctor informed care very seriously. I've learned over the years that there are a lot of factors that play into how a patient shows up for a simple visit. There are a number of psychosocial factors that impact not only their overall health, but what their perception is of healthcare too. And I try to meet people where they are. There's often many different options that a patient has at their disposal, and understanding that there's no right or wrong choice. It's just what feels right to them at the moment. And that because there are options, that if they pick one and it doesn't give them the desired outcome that either they or I feel could be optimal, that there are other choices and that they can always come back. One of the areas recently that I've been doing more research in and doing more talks about, because it often gets missed, mainly because patients also feel like, oh, that might not be as important. And I think that healthcare professionals are often a little shy or intimidated to ask, or don't even know how to help patients, but that's the area of sexual dysfunction. And so it's interesting to me that when I ask the question, sometimes the first time, people will say no, and I can tell that they're even a little embarrassed by the question, but maybe by the next visit, or it might be 2 or 3 visits later, they will come back to it. So I've made asking about whether or not there are any issues with sexual function. I try not to say dysfunction to them, but are there any issues with sexual function at every encounter, even just a routine gynae exam? Midlife women's health and beyond is complicated. And there is not one menopause syndrome that every single person experiences. Everyone is going to go through it if they're born with ovaries. If they don't go through it, it means that they're not here with us anymore. So if you are lucky to live long enough, you're going to go through menopause. It doesn't have to be a bad thing. It's not a negative connotation. It is inextricably tied to the aging process. So it's often difficult to truly untangle what is due to menopause versus what's due to chronological aging. And there's a stigma around aging in this country especially, and being able to address specifically what symptoms one is experiencing, discuss whether or not they even want treatment for it. Sometimes people just want to know that this is a normal experience and this too shall pass. But understanding what symptoms might be related to this midlife change and exploring different treatment options, and then understanding really how they can live a very healthy, autonomous life.